This video we will discuss about ARDS. ARDS stands for Acute Respiratory Distress Syndrome. So it is an acute inflammatory syndrome, manifesting as diffuse pulmonary edema and respiratory failure, which cannot be explained by what is correlated to left heart failure. Now coming on to the etiology, either it is direct lung injury or it is indirect. For the direct, I want you to remember acronym as toxic LPG. So by toxic we have toxic gas inhalation. By L we have lung contusion. By P remember pneumonia. By G remember gastric aspiration. For indirect, you can remember there is a girl named Gabs, and she has pancreatitis. Okay, so G stands for gram negative sepsis. A stands for acute liver failure. Then B stands for burns. S stands for shock, and pancreatitis as it is. Okay. Now coming on to the pathophysiology, what really happens in ARDS? First of all, there is acute inflammation, due to which there is an increase in the permeability of alveolo-capillary membrane. Okay. Now due to this increase, there we see pulmonary edema. Now to understand it better, we have three stages in ARDS. Okay. So in the three stages, you can remember the three stages as EPF. Okay. First of all, we will have an exudative stage. Then we will have a proliferative stage. Then we will have a fibrotic stage. Okay. Now in exudative, remember it happens for 1 to 7 days. This remains for 7 to 21 days, and this is for more than 21 days. Now this is also called as the wet phase. This is called as the filling pus phase, and this is called as the hardening phase. Okay, these are the vague terms that you can remember and mention. Now in exudative, what happens is there occurs diffuse alveolar damage in the first week. Then there is resolution of the pulmonary edema, and there is proliferation of type 2 alveolar cells. Now there is squamous metaplasia, followed by interstitial infiltration by myofibroblasts. Then there is early deposition of collagen. Now in the fibrotic, what you see is there is obliteration of the normal lung structure, obliteration of normal lung structure. There is diffuse fibrosis, also cyst formation. Now for the risk factors, I have mentioned them before. In clinical features, there will be tachypnea, dyspnea, hypoxemia, increase in the shunt fraction, increase in the dead space ventilation, decrease in pulmonary compliance. Okay. Now we will discuss the one important thing in this is Berlin's criteria. So for the diagnosis, we look forward to Berlin's criteria. Now for this, remember there is a brand called as Bape. Okay, so instead of Bape, I want you to take the idea of Bape, and I want you to remember Baper. Okay, suppose there's a person who wears babe and we call him Baper, suppose. Okay, so by B I mean bilateral opacification on the chest x-ray. Okay, by A I mean acute onset, that is less than 1 week. By P, I mean PaO2 ratio is to FiO2 is more than 300. By another P, I mean that the wedge pressure is less than 18 mm of Hg, less than, okay. And by R, I mean that the respiratory failure is not explained by congestive heart failure, okay. Now coming on to the management. First of all, you have to treat and identify the underlying cause. Then ventilatory support. Ventilatory support may you will give application of PEEP, lung protective ventilatory support strategy. Then we will do restore and maintain hemodynamic fluids. Either we will replace the fluid or we'll give some vasopressors and inotropics. Then complications, we have to prevent the complications. Adequate nutrition. Then over sedation, we will use weaning protocols and spontaneous breathing trials. However, sometimes in proliferative stage, corticosteroids are given, but this is questionable. Also, resuscitation with saline. A very important thing to remember, we use beta agonists in the treatment. Now, beta agonists have four functions that they perform here. First of all, they benefit, they provide beneficial effects on pulmonary mechanics. Then they show anti inflammatory action. Then the stimulation of alveolar epithelial or endothelial repair. And the last function being that they improve the fluid clearance in alveoli. This completes ARDS. ARDS is usually asked as a short note, so this is the length. Yeah, thanks.